Good afternoon, students.
Good afternoon.
So today we are going to see about the heart auscultation. So we all know, the heart is the major organ which is doing the pumping action, where the sound is being produced as love and dove sounds. Right? Are you aware of it?
Yes, ma'am.
Yes. So today we are going to see how this love is being generated and how we can auscultate with the help of the stethoscope. So for that, to assess the heart auscultations or to assess the heart sounds, we need to have a tray, especially a kidney tray, and some on board with cotton swabs. Of course, for disinfection of our hands as well as the stethoscope, we can have the alcohol sanitizer. So to start off with that, we are also having a main instrument which we are going to use the stethoscope. As we all know, the stethoscope is mainly going to be used for auscultating of all the high pitched and low pitched sounds. So in order to assess the high pitched sounds, we can use the diaphragm, and to assess the low pitched sounds, we can use the bell of the stethoscope. So this instrument can be used for auscultating not only heart sounds as well as lung sounds and vowel sounds. So today, as we are going through the heart auscultation, we are going to go only with the heart lung sounds, which is S1 and S2. So the S1 and S2, whatever it is, it's nothing but it is the closure of the valves. What is it? It is the closure of the valves. So here the valves is, which means that is the aortic and the pulmonic valve closure, as well as the mitral and the bicuspid valve closure. So in order to analyze where this aortic valve is present, where the pulmonic valve is present, we have certain landmarks. So let us see in detail about the landmarks. So here we are having Mr. Roy as our client today. He has come with some palpitation, so we are going to do some auscultation of the heart. So here the heart, as it is, we all know where it is situated. Yes, Sam, can you please say where it is situated? So in the between the intercostal space, you say. So we can't say blindly like that. In order to have the definite landmarks, we have certain findings of how the heart is being present. So always we all know, you can just draw an imaginary line between the nipples, and to the center of the sternum is your heart, between the two lungs. But still here we are going to see the valve closures of not only the valve which is present inside the heart, that is the mitral valve as well as the tricuspid valve. We are also going to see about the great arteries, that is the pulmonic valve and the aortic valve. So can you please come a little closer? So yes. So when you want to know where is the aortic area, so you have certain landmarks in the chest where we call it as the aortic pulmonic area. Then you have the tricuspid. Between the tricuspid and the pulmonic area is your Erb's point, and then you have your mitral area. So to be more specific or more concise, you can have a small calculation that is from the that is from your intraclavicular region, which is your first intercostal space. So then you have to draw your fingers or you have to palpate for the first rib. Then followed by that you have the second rib. So after the second rib, between the second and the third rib, you have the second intercostal space. So second intercostal space, center you have the sternum. Second intercostal space, right sternal border. That is, sternum is present over here. Border is very close to the sternum. Second intercostal. So first and second intercostal space, you are going to have your aortic area. Then followed by that, you have the just opposite to it, to the sternum, but towards the left side. That is, again second intercostal space, where left sternal border is your pulmonic area. Followed by that, you have the area between the pulmonic and the tricuspid area, which is the third intercostal space, which we call it as the Erb's point. Then fourth intercostal space, again left sternal border is your, what is it? Tricuspid area. or your tricuspid valve. Then, followed by that, just below it, you have the fifth intercostal space, mid-clavicular line. So, this is your clavicles. You draw an imaginary line between these two. At least it is around 5 to 6 centimeters. So, third point you can take and draw an imaginary line, fifth intercostal space where it joins is your mitral area. So, this is how we check in for how the landmarks of before you do the auscultation. Now coming to the auscultation, always we go in for S1 sounds as well as S2 sounds. S1 is always closure of the mitral valve as well as the tricuspid valve. S2 is always closure of the aortic and the pulmonary valve. So once the right side chamber and the left side chamber of the ventricles is filled, then from here the heart is purging to the lungs and systemic circulation. So you can remember like that. So now can we auscultate? So before you start, always check whether the stethoscope is working, because here you have the on and off switch. So in order to be more precise, you can use your sterile cottons and always disinfect, because the earpiece should be disinfected in rotatory technique, so that the healthcare worker is not going to develop any ear infections. After that, see that you explain the patient that I am going to do the procedure, and do not cough or do not do any other adventitious breathing. That is what the patient will think, oh, the healthcare worker is checking, so let me hold the breath, let me relax, or let me do fast breathing. All that should not be done. They have to be very as usual they can. And mostly according to the book, what they say is that if the patient is able to sit, always auscultate the heart sounds in a sitting position. As this is a dummy, we are doing it in the lying down position. Then you have to assess whether it is in on or off just by giving a small touch over your diaphragm. Then you can assess the first, that is the fifth intercostal space, mid clavicular line is your mitral valve. So you listen for 1 full minute. Then followed by that, you are going to assess fourth intercostal space, left sternal border is your tricuspid. So you have to hold this teeth like this. Followed by that, you are going to compare S1 with S2. So aortic area, second intercostal space, left sternal border. Analyze. Then again, second intercostal space from the clavicle, then to the left sternal border, pulmonic area. After that, if you hear any abnormal sounds such as S3 and S4 gallop rhythms, then we have to immediately plan for any other procedure or escalate to the doctor if the patient is having some sort of murmur sounds if we hear. If you hear any turbulent sounds like murmuring sounds, then we have to use the bell of the stethoscope, which is nearly abnormal. So today we have seen how to auscultate the heart for a normal client, normal adult. In case of a diseased client, we have different heart sounds, which is S3 and S4, which will be saying in the next class. So today I want any one of you to come and do the detail. Who is willing? Yes, Kartika. Yes, you may start.
Heart sound auscultate பண்ணுறதுக்கு 5 steps இருக்கு. ஃபர்ஸ்ட் இது வந்து அயோட்டிக் வால்வு, இது வந்து பல்மோனிக் வால்வு, இது ஏப்ஸ் வால்வு, இது வந்து ட்ரைகஸ்பி அண்ட் தென் இது வந்து விட்ரல் வால்வு. இந்த சைட்ஸில் தான் நம்ம வந்து ஹார்ட் வந்து சவுண்ட்ஸ் வந்து ஆஸ்கல்டேட் பண்ணணும். ஃபர்ஸ்ட் ஆனில் இருக்கான்னு பார்த்துக்கோங்க. ஃபஸ்ட்டு மைட்ரல் வால்வு 1 minute வச்சு செக் பண்ணுங்கள். Next அடுத்து பல்மோனிக்ல.
No, it's the tricuspid.
ட்ரைகஸ்பீடில் 1 மினிட் வச்சு செக் பண்ணிவிட்டு நெக்ஸ்ட்டு அயோட்டிக்கில்
and pulmonic.
அண்ட் தென் பல்மோனிக்.
It is not necessary you go in for one full minute. So if you know the patient is a normal adult, you can go for 30 seconds where you will complete the heart sounds within 2 minutes. But in case if you find any abnormal sounds, any other whooshing sound or gushing sound, that may indicate the patient is having some cardiac problem or some left ventricular thickening. In those instances, then we go for one full minute count. Anybody else wants to try? Give clap hands for Excellent. Next time try to speak only in English. Racing.
5 areas to assess the aspirated the chest heart sounds. First the aortic valve present in the second intercostal space. In the left side, right side, left side the pulmonary valve are present. Then the second intercostal space, and the tricuspid valve is present in the fourth intercostal space.
Yes.
And the mitral valve present in the mid clavicular line.
Fifth intercostal space, mid clavicular.
And take the stethoscope.
Between the tricuspid valve and the pulmonic valve, you have the Erb's spots.
Take the stethoscope.
Always disinfect before you use the stethoscope. If it is a short one, if it is your own personal one, then you can use it. Spot ones.
Use cotton buds to clean the check the
Yes.
mitral valve in the fifth interval space. And check the tricuspid valve in the fourth interval space. And check the aortic valve in second intercostal space. And check the pulmonary valve in second intercostal space, the left.
Then thank the
Thank you.
patient and you can cover the patient. And give reassurance. And tell him, thank you, sir. Thank you, so we'll see with the abnormal heart sounds in the next class. Thank you.
Thank you, ma'am.